You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you. Hello, this is Richard Jacobs with the Future Tech Podcast. I have Tjasa Zajc. She's the head of her own podcast called Faces of Digital Health. So Tjasa, thanks for coming. How are you doing?
I'm doing great. Thank you for inviting me to the show.
Yeah, tell me a little bit about your journey. Why focus on digital health? Unfortunately, I'm sure you probably have some kind of, you or someone has some kind of big health issue that maybe led you in this direction, but maybe I'm wrong. What's your backstory?
No, you're actually not wrong. So right before I started high school, I got diagnosed with IBD, which is a chronic condition. And I still decided to become a journalist, which is a stressful job. And my mother advised me against going into the profession because it would probably influence my disease. But I later studied healthcare management and economics to understand healthcare beyond the patient perspective. And I ended up as a medical journalist for a Slovenian medical journal for doctors, which enabled me to explore healthcare from a different perspective, focusing mostly on how doctors view healthcare and what kind of problems they're facing and what are the new discoveries from the core medical science. Later in my journalistic journey, I started a podcast at the magazine that I was working for. It was first called Medicine Today on Digital Health, but then I moved to the healthcare IT industry as a business developer, but I still wanted to continue the podcast that, as you mentioned, is called Faces of Digital Health. And there I'm trying to explore how different healthcare systems are adopting technologies, because I really like to see how different cultures are approaching the same problems, or how problems differ based on the culture and based on the country. So that's in short.
What's to you, what's the most important part of health that needs to be solved sooner rather than later?
That's maybe a difficult question, but then again, based on how much I know about different healthcare systems, I would say that access to healthcare is still a very big issue in developing and developed countries. For example, I come from Slovenia and we have a public healthcare system. So that means that if you're employed, you are insured and you have access to healthcare. It's impossible to get bankrupt because of the healthcare costs here in Slovenia. Even, for example, if you lose your job and you are jobless, you can apply for a health insurance and it costs around 50 euros per month. And that still enables you to be completely covered 100% with the medical costs for expensive drugs in case you get a chronic condition or a rare disease or conditions that are usually very, very expensive. So on the other hand, if you look at the US or if you look at a lot of Asian countries or African countries, you quickly see that a lot of expenses are out of pocket and there is a very small percentage of the population that is privately insured and has access to healthcare. So the culture that I come from, we believe that, if you get a condition that you did nothing wrong to get it, that are genetic disorders or chronic conditions, it's really unfair that you would be treated differently or you wouldn't have access to healthcare to live your life just because of this condition that suddenly appears.
Well, when you say accessibility to healthcare, do you mean, like, I imagine some countries in Africa, you literally might have to walk 20 miles to go see a doctor, or there's just none in your area. While in developed countries, it could be, I can't afford health insurance, and that limits my accessibility. Like, when you talk about access, do you mean all kinds of access, or what kinds?
Yeah. Basically, access also because of the costs related to healthcare. So, for example, I don't know who exactly, but one of the people that I spoke to, a doctor or something. Oh, actually, it was, I know who it was. It was Hal Wolf from the CEO of HIMSS, who said that, in let's say, New York or in US, you can literally live next to a huge hospital because of the waiting times or because of the costs related to the healthcare, you actually don't have access because you can't afford it. So that's what I mean when I mean access to healthcare in the broader possible sense, either because of the distance or either because of the cost.
So what have you learned? Like, if you were to build your own healthcare system by assembling the pieces that you like from the systems you've seen, like, what would it look like? What would it include?
Oh, that's actually a really, really difficult question, because there's various models that are interesting, and it's fascinating to compare healthcare systems and see how many different ways of approaching to healthcare they have. So, for example, the UK has a public system where the healthcare is paid through taxes. And I actually really, really liked the system in Singapore, where you are obliged to be insured for healthcare, and they have some sort of saving accounts where you collect the money that can be used then for your healthcare costs. There's also this question of how much should you contribute, so that you don't see healthcare as just something that you're entitled to. That's a problem in my environment, because we don't pay anything for the drugs, we don't pay anything for the visits at GPs, and that can cause that people go see doctors even when they don't really, really, really need to. So like countries such as Sweden have systems where you have to pay a minimal fee when you see a doctor, or France, for example, you get an invoice just so you know how much the treatment that you got costed. So if I had to create a healthcare system, I guess I would look at something that enables accessibility, as the UK system does, and kind of incentivize people to be mindful about their healthcare costs and save for the potential healthcare costs, as Singapore did.
What about people that are very sickly and older, which they tend to skew to be, versus the young people? Like, what should be asked for of a 22-year-old that feels great and has no kids? How should they contribute to the healthcare system versus someone that's like 65 and has a couple of chronic conditions and needs a lot of care? Like, how do you reconcile those two within the same system?
Well, I think the key thing is that basically the Ministry of Health or the healthcare system is designed on the political level, so because you're never going to convince young people that they don't have healthcare problems to save, for when they're going to be old and when they're going to be sick. I think it's a similar thing with retirement funds, where for example, some countries, Slovenia being one of them, have a problem because people want to just move towards a freelance model where you just get all the money that you make and don't put much money or any money in the retirement fund, because young people to a certain extent lost hope that they will ever retire. So when it comes to healthcare, if you're healthy, you of course don't think about how it would be if you're ever going to be sick. And so that's why I think healthcare needs to be solved on a different level,
How many healthcare systems have you looked at, over time with your podcast?
So recently I started doing series, and I recently did a series about Asia. I'm currently in the middle of a series about Africa, where I talk to people from Tanzania, Rwanda, Nigeria, and South Africa. And then I randomly covered also a lot of countries in Europe. I often talk to experts from the US or Canada. So I'm, really trying to look at the global perspective. I also had Australia. One continent that I really haven't covered yet is South America. There is one interesting project going on there, and that's in Bolivia, where a VR surgeon, Shafi Ahmed, is actually leading a very interesting hospital that's supposed to incorporate all the newest technologies to enable the best possible 21st century patient experience. And you can listen a little bit more about that in one of the podcasts I did, which reminds me that I should probably do a follow-up because that was a year ago, and I'm sure that a lot of things advanced in that project by today.
So what do you notice in the different continents and the different systems? Like, are there tons of different systems out there? Are there only a few variations? And like, which ones are more successful than others?
Well, I think an interesting thing that I can mention is that a lot of Americans, when they move to Europe, are fascinated about the access to healthcare you can have in Europe. The fact that you really don't have to worry that you would get in financial problems because you get sick. Another interesting thing that I recently heard through my interviews was about Africa, where I talked to an amazing entrepreneur from Tanzania, Maria Kadushi Samson, who is working on medical education. And what she told me there was fertility or teen pregnancies are a big issue in Africa. And the reason there's so many teen pregnancies and later why women have a lot of children is because they're just not educated about protection and just how to manage how can you prevent from getting pregnant. And so the thing is that they don't get educated a lot about that in schools. And what this entrepreneurs startup is doing is they are providing medical information through mobile phones. Now, the interesting thing that she told me was that, for example, in Europe or in developed countries, we are talking a lot about data privacy. And that means that we are concerned which company is keeping our data and where the data is going to land. But in Africa, where the society in many parts is still very patriarchic, and men are the heads of the family, the concern about privacy from women's side is, how can I prevent my husband from seeing what kind of information am I searching for, because, if somebody is looking up symptoms of STDs or pregnancy, a husband might get suspicious. So, that was one thing that really, really stuck with me. And it shows how different cultures face very different problems and need very different solutions.
Yeah, that's really interesting.
Yeah.
Do you think that a lot of countries get it right, or are their systems just a complete mess? Like, how close to the mark? Is there any country you think that really is close to getting it right?
I think, well, the thing is that if you look at reports about healthcare systems, reports are very, how can I say, very stiff in a way. I think any system that you will look, doctors will probably say that they are overburdened with work, with workload. They would like to have more time with patients. And then if you compare the numbers, for example, Europe has between 3 and 4 doctors per 1,000 people, and doctors are still dissatisfied. Let me just give you one comparison. Slovenia has 2 million people, and we have 6,500 active doctors. And then a country like Rwanda has 12 million people, so 6 times as much as Slovenia, and they have less than 700 doctors, So the differences can be really, really, really striking. I think like China, for example, also has a lot of healthcare issues. But if you look at the book AI Superpowers by Kai-Fu Lee, and if you check some of the discussions that I had with people that are active in the health tech space in Asia, they shared some very interesting stories about startups addressing healthcare access problems with new technologies. So China is really, really, really advanced when it comes to AI. And they've got, for example, Ping An Good Doctor is a startup that is that has an ecosystem for access to doctors. And I think they offer a triage which is based on AI. And their AI model was designed by 200 AI specialists. They have 1,000 full-time employed doctors and work with 5,000 part-time employed doctors, so that they can support 24/7 support for anyone who enters the ecosystem. And it's okay. So from an outsider perspective, that looks like just a platform, that enables you to do telemedicine and just access a doctor when you need one. But when you see what kind of problems China faces, that people actually don't trust their primary care physicians and travel to big hospitals in big cities, and they literally wait for days in a hospital to get just a 5-minute consultation with a doctor. If you Google the news and see the situation in the hospitals there, then you can really see what kind of an impact a solution like Ping An Good Doctor has. So, that's another example why I'm really fascinated about how different healthcare systems approach different healthcare problems.
So what do you want your role to be? You're bringing information of this to your listeners in the podcast, but beyond that, what do you see as your role in improving healthcare systems or access to it around the world?
Basically, another thing that I'm doing, which is actually my full-time job, is I'm a business developer for a company called Better. And I'm in the team that's working on a medication management software for hospitals. When I was doing my master's degree in healthcare management and economics, I compared how different hospitals manage drugs, how drugs go from the pharmacy to the wards, what kind of problems arise in these transmissions. And what the team that I'm in does is we provide a digitized way for hospitals at the moment prevalently in the NHS to manage patients as easily as possible. So when you're admitted to the hospital, that the pharmacist has an easy way to do the medication reconciliation, so to create all the chart of all the medications that you're taking. And then when the doctor prescribes new drugs, the pharmacist can in the same system easily check if there's a problem with the different medications that you have to take. And then in the end, the nurse has an easy electronic way of looking at which drugs she has to administer in which way and when. Now, this perhaps might seem as nothing special for the US listeners, because the IT is much more advanced there, but in the NHS, specifically in the UK, a lot of things are still done on paper. So we're digitizing this part of the healthcare system.
I mean, here it's only very recently that things have gone off paper, but when you go to the hospital or the doctor, you still get asked multiple times, and you got to write stuff on paper, and it doesn't seem to be nearly as integrated as it could be. There's still a lot of room for improvement, it seems like.
Yeah, definitely. That's why there's an increasing emphasis on ideas that you would have a personal healthcare record that you would basically carry around to different healthcare professionals, or there's networks that enable you to give or revoke access to your medical record based on the doctors that you wish to interact with. So yeah. I mean, healthcare IT and EHR are a complex topic for sure.
Well, one thing too is, let's say you're 50 years old. You've been going to the doctor probably for 30 years. And you need to go to a new doctor. How do you get all your old health information? Even the past 10, 20 years, or all the relevant stuff. Right now, you have to call it up from memory. But if there was a way to keep that electronically in one spot, so you didn't have to go ask doctors to get it for you, and it was pooled in one area under your control, and you could share that with your new doctor, it would make treatment a lot better, I would think.
Yeah, I think like new generations, babies, young people that are aging slowly, they're going to have this advantage that their medical records are going to be more digitized, and you are going to have more history in an electronic form. I think like for people who are 50 or older today, nobody's going to go digitize healthcare records to that are on paper at the moment, because that would just be too much work. So yeah, there's a lot of companies that are trying to address these issues. So let's see who's going to be the market leader in that sense.
Well, what's your sense of what's possible in the next few years? With the NHS or in general, what big changes do you see coming in the near term?
Well, I mean, personally, so one of the series that I did was also about AI in healthcare. And I must say that a thing that really fascinated me was the potential of voice assistance in healthcare. I remember that 2 years ago, I was at Health 2.0 in Santa Clara, and everybody was already so excited about voice technologies. And at the time, I didn't quite get what's the fuzz about it, But after an interview with Bill Rogers from Orbita, I really grasped like how different it is if you say something to a machine and that machine is able to give you some feedback, compared to if you need to type something in an app and record it. It's less work, it's faster to use your voice. And if you check Orbita, you're already going to see use cases of really amazing potentials that we'll see in healthcare. One thing that I am kind of wondering is, because like all these technologies cost something, so I am wondering if new technologies are going to bring more access. This also refers to advancements in diagnostics, which is expensive to a certain level. So if all these new things cost a lot, does this mean that basically the people that can't afford them are going to be in a disadvantage because they won't use all the sensors and all the data capturing devices and systems that can combined bring insights about yourself? So there's a lot of questions that are going to be open, but I'm keeping my eye on what's happening with voice technologies and how they are making all the contact with IT systems and digitization more user-friendly.
Well, very good. Well, Tjasa, what's the best way for people to get in touch with you, ask you questions, pay you $1 million to consult with their healthcare system? How do they get in touch?
Well, the easiest way is to just, go to the website of the podcast, which is www.facesofdigitalhealth.com. And they can also find me on Twitter. My handle is @ZAJCTJASA. So that would be a good start.
Well, very good. Tjasa, thank you for coming on the podcast. And the work you're doing is, it has a lot of potential to really help a lot of people. So thank you for what you do.
Thank you for inviting me.
You're listening to the Future Tech Podcast with Richard Jacobs. Future technologies such as artificial intelligence, stem cells, 3D printing, gene editing, Bitcoin, blockchain, the microbiome, quantum computing, virtual reality, and exploring space are much closer than you might think. In fact, many early versions of these technologies are in play right now, and the companies that are using these technologies are the focus of this podcast. My goal for you, the listener, is to learn from these podcasts. You may very well learn something that may change the course of your life for the better, steer you towards a new career, or give you insight into addressing a thorny medical problem. Remember, this podcast and its content is informational in nature only. No medical, tax, legal, financial, or psychological advice is being given. If you've enjoyed the podcast, please listen, subscribe, like, and tell your friends about it. Thank you.